lot that not many people really know the long-lasting effects of what it's like living with a CHD. People have some interesting assumptions about what it's like.
Like what kind of assumptions, Molly?
Hey Molly, since you had all of your surgeries when you were a baby, you didn't have to deal with anything in your childhood, right?
You know, that is an interesting assumption. Actually, myself and like most people with CHDs, we actually face like a lifelong risk of all these different health problems like growth in eating, developmental delays, difficulty with exercise, heart rhythm problems, even things like cardiac arrest and heart failure.
Wow.
Yeah, I know personally, my heart was still not strong enough as a baby, so I had to eat through a feeding tube. And so I didn't even learn how to eat until I was 6 years old, and I hated it until I was about a teenager. I actually have a little scar and I call it my second belly button. And you've seen that I don't like to go up the stairs, and it's really hard for me. So yeah, there are things I'll have to deal with for the rest of my life, but that's okay.
Wow.
Thank you for asking.
Thanks for sharing.
Yeah.
Hey Molly, because you have heart problems, can you have kids?
You know, that's a great question. A lot of people have that question. Actually, most people with CHDs can have children, but you have to be monitored extra closely, and there are a lot of extra precautions and risks. But actually, some people with really serious heart conditions, pregnancy is actually not recommended for them. But for the most part, we're pretty okay.
That's actually really interesting. So because you had a surgery, Molly, does that actually mean that you're cured?
That's a good question, and quite a common assumption. Unfortunately, surgery is not a cure for congenital heart defects. It's kind of just a way to help us to be able to live the best life that we can. But most of the time, people with CHDs will have to have other operations or take medications. I know for me, I'll have medications that I'll need to be on for the rest of my life, and I keep having to get my blood drawn because of some of them, and there's a certain procedure I'll always have to have every couple of years to make sure everything's looking good. That is crazy. You know, people have said some really interesting things to me once they find out about my illness and stuff.
Okay, like what? What kind of things?
Well,
Yo, bring that in. No! Molly's fragile! Didn't you know she has a heart condition? I am so sorry, Molly.
Micah, thank you so much for your concern. You're actually not the first person to say that to me. But actually, all of us with chronic conditions, we do know our limits and what we should and shouldn't do. I'm not a China doll, thankfully. And one thing I can do is bring that in.
Yo, bring that in. Yeah.
So, Molly,
Yeah, what's up?
you think I could, see your second belly button?
Not again.
Fine. You know what, Molly? Thank you for sharing this information, because honestly, you don't really look that sick.
You know, that's actually a common thing that I hear, and a lot of people that I know with health conditions hear that. It's interesting because it makes you feel like you have to look a certain way in order to have some kind of disease or chronic condition. Yeah, it's pretty interesting. So don't always assume that just because someone is doing well that there's not something going on. And that's why we need to educate ourselves on all the different things, like congenital heart defects. Thanks, Olivia.
Thanks to you, Molly.
Insane.